registered for the international trademark, as well as in Korea and in the USA. Bioflex Spring Rod System. At first, Bioflex Spring Rod System has changed the material from 6 mm of titanium 6 AlV4 to 4 mm of nitinol, a typical shape memory alloy. Next, we has changed the design from straight rod to coil turn rod. Thanks to these alterations, Bioflex Spring Rod System could achieve not only flexibility without stress shielding effect, but also durability for strong supporting power. There are 2 grooves, holes on the pedicle screw head of Bioflex Spring Rod System. Because of this property, we can adopt the segmental connection method even for multi-level cases more than 2 levels. Competitive advantages of our products. Bioflex System can achieve the fusion rate of good quality in the anterior part of spinal column. As a result, we can satisfy the various definitions for fusion. In particular, compared to the traditional rigid system, Bioflex System can provide more micromotion or stimulus in the anterior part continuously. Therefore, according to the Wolff's Law, it can help the secondary bony union, and finally bridging bone can be formed after 1.5 or 2 years from the operation. Bioflex System has showed very low incidence rate of ASD, adjacent segmental degeneration. Traditional rigid system has needed the reoperation by symptomatic ASD, adjacent segmental degeneration, in 10 to 20% of patients. However, in case of Bioflex System, the rate of symptomatic ASD, adjacent segmental degeneration, is only 0.4%. This amazing difference is caused by the normal load transmission and shock-absorbing mechanism by nitinol spring rod, which is the only distinguished feature of Bioflex System. Bioflex System can prevent stiff back syndrome. Thanks to the 3-dimensional flexibility of Bioflex nitinol spring rod, we have very small restriction about various motions. That is, it is accessible to more unrestricted motion in various spinal motions, such as flexion, extension, lateral bending, and rotation. Therefore, patients do not complain to spine surgeons about the discomfort by the motional limitation. Bioflex System has very strong supporting power as a posterior fixator. In particular, in case of spondylolisthesis, a typical clinical indication among degenerative lumbar disorders, even after the successful reduction of the sliding segment, it is very important to maintain the condition of natural sagittal balance continuously for the better secondary bony union of anterior part. Thanks to the strong supporting power of Bioflex nitinol spring rod,